This is Ligeia Ricciardi. I'm the Chief Transformation Officer at Carium, and I'm here at CES 2020 in the Digital Health Live Studio, and I have the pleasure of interviewing Dan Brounstein, who's with Saluda Medical, where he's the Senior Vice President of North America. Welcome, Dan.
Thank you. Thanks for having me.
Yeah, so Dan, you just participated in a presentation on the CES stage. What were you talking about?
Oh, it was an exciting presentation about how do we change the landscape of chronic pain. You know, and I think you've already had a couple of good discussions about this, but huge problem. 23 million people that are in the United States have chronic pain, yet you know, where do they find alternatives? Where do they find treatments? And you know, at Saluda Medical, what we're trying to do is redefine individualized care for patients.
So talk a little bit more about that individualization process and how you're able to do that and what it looks like.
Yeah, so our device, we're not currently on the market in the US, but we just started to sell the product in Europe. The device itself is actually a system that stimulates the spinal cord, but then it actually can listen and measure the response to the spinal cord and then deliver an individualized dose of therapy. So all the systems that are out there are fixed output and open loop, and they just deliver energy into the spinal cord, but don't really understand what it is actually doing. So we're trying to transform how we deliver the therapy and individualize it for every single patient. Every patient is different. Every patient, just like a dose of medicine, every patient has a different amount of therapy that they need.
And does therapy for an individual sometimes change over time?
It does, and so you have to monitor continuously the amount of therapy you're delivering, and I think that's why we're here at CES, is that the device takes 5 million readings a day. It stores that information. We're able to look at it and then change the stimulation based upon that, along with the device automatically doing that in a real-time basis.
Got it. And I understand you just released a publication.
Yeah, it's really exciting. Our 12-month data on our U.S. pivotal study was just published in the Lancet Neurology, which
Congrats.
Thank you very much, which is one of the highest impact factors that's ever been published in the space, meaning that it's going to reach a lot more people and hopefully build a lot more awareness for chronic pain management.
Fabulous. And so final question, if you're back here in the same seat next year at CES, what are you looking forward to, or what do you hope to have accomplished or seen happen in that time frame?
Well, hopefully we've changed the way we treat therapy outside of the U.S. and Europe and Australia, and hopefully we're about to bring this to the United States. So we're excited about that.
Sounds good. Yeah. Thank you, Dan.
Thank you.
Thanks for joining us at CES 2020 in the Digital Health Live Studio. I'm Ligeia Ricciardi, signing off. Thank you.